Good afternoon and welcome to Genomics Gupshup. Genomics Gupshup is an initiative by MapmyGenome to create a community around genomics and to simplify genomics for everyone. And we do this by bringing together experts from allied areas like medicine, genetic counseling, nutrition, fitness, and more. Please join us as we spread the word about this exciting science of genomics. We are now available on your favorite podcast as well. Just search for Genomics Gupshup on Apple, Spotify, Amazon, or Google Podcast. In our 43rd episode, we have Dr. Pandu C, who is a pediatric gastroenterologist, hepatologist, and nutritionist at AIIMS Cuddles Hospital in Hyderabad. He has a rich experience in treating various gastrointestinal and liver disorders in children. He's also an expert in performing major endoscopic procedures such as an upper GI endoscopy, sigmoidoscopy, proctoscopy, capsule endoscopy, and liver biopsy. He has published several papers in reputed journals and has participated in many conferences and seminars on pediatric gastroenterology. Dr. Pandu Chauhan, welcome to Genomics Gupshup, and thank you for being here.
Thank you, ma'am, for a generous introduction. Okay. So I want to thank MapmyGenome Group for giving me this opportunity. So we'll continue this, ma'am.
Thank you, Dr. Pandu. So maybe we'll begin by starting off with what inspired you to specialize in pediatric gastroenterology, especially in the context of genetics, and what keeps you motivated in your work?
When you look at the pediatric problems, ma'am, generally, so around 1/3 of them are related to GIT. Okay. So whether it is in OPD or it can to the IPD, 1/3 of the problems, most of them can be early recognized and can be treated in a better way. So that inspired me to take pediatric gastroenterology. You can treat them, I can make them life easy. So what inspired me to become a pediatric gastroenterologist? And moreover, in pediatric gastroenterology, earlier we have many disorders which we don't know the etiology exactly. We treated them in the phase-wise manner. Right now, with the availability advent of the genetic test, we are more and more new diseases are discovered, which are we can treat them and can counsel easily, and we can take to the advanced therapies as well.
So you were at AIIMS, is that correct? Or?
Yes.
So it's a great place. I think you get to see many different patients, I guess, from
all spectrum of pediatric gastroenterology, hepatology, and as well as with different nutritional illnesses. So there we have opportunity to intervene by not only for supporting conservative therapy, we can intervene by different therapies like interventional endoscopies or by providing advanced therapeutic support or by nutritional support and for metabolic diseases and even for liver transplant support as well. So there we try to work up for the all etiological causes and how it inspires us to know the rare diseases and how we treat them in a simplest manner as well. So though some diseases are rare, but we can treat them in the simplest manner, which is the simple and has to be followed every day. Yeah, that is me.
So that's great. So you're an expert in many different kinds of scopies, right? Like endoscopy, sigmoidoscopy. Can you help understand in simple terms what each of those means really for another person?
So when it's come to the gastroenterology, so we have the endoscopy, which by the camera system we can look into your gut. Okay. So by endoscopy, we'll insert the camera along with the tube into the mouth, and we'll see inside the stomach and small first and second part of the stomach. So there we can identify any lesions like ulcers, any growth. Okay, we can also identify infectious, and moreover we can identify the varices which are present chronic liver disease children. Okay. So this endoscopy endoscopy helps in diagnosis of the different lesions in the stomach and intestine, and also in cases of food allergies or food intolerances, like in case of enteropathies like celiac disease. The one of the diagnostic mode is the endoscopy, the definitive diagnosis by the biopsy. So here the diagnostic requirement is the endoscopy here, as well as a therapeutic, like if there is any bleeding ulcer, we can apply a hemoclip and stop bleeding. At the same time, if there is varicose bleeding, then we can apply the band. At the same time, if there is stricture, the narrowing of the food pipe, we can make it dilate it. And so these are the different diagnostic and therapeutic mode. If there is polypectomy, you can remove the polyps. So these are different applications of the endoscopy in pediatric gastroenterology.
So I guess one interesting thing, I mean, you mentioned obviously the gut is one of the most interesting things and there is the whole microbiome that exists in our gut, right? Like you mentioned that there are some infectious things or problems that are there. So do you think that by looking at the gut microbiome, for instance, understanding what your bacteria and fungi and others will say, do you think that that area is now, we are seeing a lot more advances from a technology point of view, but from a practice point of view, do you think we are there today in terms of how you would use something like a gut microbiome in your normal practice? Do you see much value in that?
Yes, definitely. The intestinal microbiome is around 1 trillion, which is more than the cells in our body. Okay, this intestinal microbiome helps us in many ways. So it helps us in shaping our immunity, maintain the barrier, and keeping the pathogenic bacteria away from the mucosal surfaces. Okay, so it is important to have the right balance of the microbiome. So there should be a large diversity should be there. At the same time, there should be the appropriate number as well. Okay, in the day-to-day practice, this is now very well known and evolving field, that very well known that intestinal microbiota will shape your immunity as well as your metabolic disorders as well. So altered microbiota can lead to altered immunity as well as some GI disorders like irritable bowel syndrome, IBDs, as well as metabolic disorders like non-alcoholic liver disease. At the same time, they can also modify the chronic lung disorders like chronic liver disease, where your pathogenic bacteria can translocate and cause the infectious. At the same time, microbiota also helps in the behavioral disorders. Nowadays, we are seeing there is emergence of the autistic disorders in children, and which are rapidly increasing in the prevalence of disease. So microbiota plays a definitely role in healthy children and healthy growth of the children. Now when it comes to the practice, so right now what evidence we got from the different studies is, we in microbiota definite role in reducing the duration of diarrhea when it's come to the acute diarrhea, have a definite role in IBS in as well as in some small intestinal bacterial overgrowth. There are a few studies, and it also helps in chronic diarrheas as well. So mainly in the diarrhea and IBS and IBD mainly.
So if you can, let's say, if we look at something like a microbiome, then clearly, like some people know that, you know, one of the ways to fix that or to change some of that could be nutrition, could be maybe supplements or probiotics. Are there other advancements in this space that that people should be aware of? That let's say today, when they come to see you, they have an IBS or they have some problem, some children have. What is typically the age at which parents normally bring their children to you with such issues? And do you think that now there is a lot of changes that have happened in this space for parents to be aware of?
Yeah, nowadays the advances of the due to availability of the different investigations, so we can advise the parents, the children with chronic GI disorders like IBS or chronic pain, abdomen, bloating, irritable. We can advise them to have the gut microbiome testing. So it gives us uh, the diversity and the number of the different species. So it definitely one thing which helps us in the microbiome testing is it can identify the pathogenic bacteria first of all, then it can also look at the diversity and their number. So it definitely helps us in identifying the pathogenics as well as looking at the diversity, and for which the child can be susceptible to some infections, allergies, as well as which bowel disorder like IBS. So it's definitely helpful. It is emerging, and children with chronic disorders and as well as GI disorders and adults can also use this as a opportunity to diagnose as well as prevent some of the disorders as well. Even when healthy children get it done, we can identify the species, then we can try to modify it by either by the diet or by the supplements or by the probiotic.
Got it. And I read that like a lot of in the West, I think we're also seeing some things like a fecal transplant and others. Is that common in India, or do you think that it will still take some time to for us to get to those kind of therapies?
Yeah, no, it is not routinely established. However, there are many trials that are undergoing for different disorders, and in few years it will become a standard of therapy in many cases, like in IBD or in cases some metabolic liver disorders. So it may, and in cases of IBS, it may become a standard care of therapy. Right now, the many trials are undergoing. We hope we'll come with the best solutions.
So, other than the microbiome that we've been discussing, what are some of the other promising advancements that we can be aware of in pediatric gastroenterology?
Yes, nowadays when it's come to the pediatric disorders, from neonatal hepatitis, cholestasis to acute liver failure to chronic liver diseases. Earlier, many of the entities, up to 50% of the cases were unknown etiology. Okay, most of them are idiopathic. Now, with the advancement of this genetic testing, genomic testing, you can call it, we are able to discover newer disorders, which helps us in the understanding the mechanism and course and natural course of the disease, which some of them are curable with very little, very small changes in the therapy, diet, from small medicine. Some may require advanced therapies. So here now we are able to understand the many mechanisms of the many diseases. For example, when it's come to the cholestasis, so jaundice in the neonates is one of the most common problem. Few of them have that high colored urine with cholestasis problem which persists. Okay, so where direct hyperbilirubinemia is more. Earlier we know very few cases, we used to treat them. Now the more and more cases of genetic cholestasis are we able to see. Now, because of the understanding of the pathophysiology and underlying etiology, we are able to treat them in a different therapy with biliary diversion, with transplant, and there is also emergence of the newer therapies to target those proteins or transporters. So there is the genetics and the genomics testings gives us a big window to look at the pathophysiology and newer diseases, so which also helps with the treatment of the children.
Got it. So I think that must be quite I think must be very much wanted now. We are seeing a lot of changes.
Yes. So many guidelines now recommend the early genetic testing. So because this also helps in the diagnosing the condition, treating prognosis as well as the prevention of the next sibling and counseling of the parents. This is very important. So whenever there is indeterminate diagnosis and you are ruled a definitive infectious etiologies and other common etiologies, go for early genetics in case of cholestasis as well as early genetics in case of even protracted diarrhea in infants.
You mentioned a lot about nutrition and lifestyle. So have you observed any recent trends, lifestyle trends that are impacting the digestive health of children? And what concerns does this raise? So if you can share some insights into the common gastrointestinal issues that children face. Clearly, I think, over the last 20 years, we have seen a lot of diet that has changed, right? Do you think that there are many more types of changes that you are observing in children now than they were earlier?
Yes, ma'am, definitely. Nowadays, you can see there is a change in lifestyle as well as change in diet. Both directly impact your digestive health. Okay? When it's come to the lifestyle, so nowadays, because of the advent of the technology, digital era, so most of the children are in the spending time with the digital devices. So screen time is increased, okay, which directly translates into the decreased physical activity, okay, as well as and excessive eating habits and inappropriate or inadequate healthy meals. Moreover, when it's this decreased physical activity and increased sedentary activity can lead itself to the constipation and altered bowel habits and sedentary lifestyle, which precipitates you to the adolescent disorders like obesity, non-alcoholic. When it's come to the diet, so because of this, there is no availability of the fast foods and processed foods and sugary drinks, and this will lead to the this contains saturated fatty acids, high sodium, high sugars. This alters the metabolism. Again, it causes the GI digestive health issues. So we have to take care of this. The advanced digital technologies available. At the same time, we should be able to take care of our health. Rather, should not be we should not fall prey to it. Yeah.
Got it. And do you think also on the other side, right, there are also people who, for instance, go a lot to the gyms these days or are worried about how they look and they all want to be in fitter or whatever. But and maybe some of them are consuming a lot of proteins, or maybe they're consuming something. Their diet might not be a normal diet. Do you think that can also cause any gastrointestinal problems in children, or do you think that is not so much of a problem as long as they are exercising well?
Even if we are exercising, the diet is important. So the first point in the first principle diet, it should be the balanced diet, or it should be wholesome. Rather, there should be no process or sugar content into it. The followed by the diet should be the calorie content. So either we reduce the portion size or we replace with non-caloric content. So first one is the balanced diet, second is the calorie, third one is we take care of the fiber intake as well. Okay, the fiber is also very important in keeping your intestinal microbiome in balance. So because of the process and this fast food, the fiber quantity has reduced and other like polyvols have been increased, which led to the IBS and other disorders, and which leads to the further disorders. So rather than physical activity is important, but it is alone cannot help you completely normalize. So diet is also important. You have to strike the balance between both of them, even the diet as well as lifestyle habits, both.
But two different people can be doing the exact same thing with a very different result, right? Do you think that genetic conditions also play a role in how that expresses in terms of different gastric problems that people might have? Because you'll find that there are people who let's say digest carbohydrates better or fats better and others. Do you think that we are seeing a lot more of some genetic influence on some of the diseases outside of, let's say, clearly lifestyle is a big problem these days, but other than that, do you think that there are also, you're seeing a lot of genetic reasons why people come to you and get treated?
Yeah, definitely. So we have earlier talked about the lifestyle and diet. There is another factor, host factor, like genetic susceptibility or genetic factors. So definitely, suppose even all children are taking care of the diet and physical exercise, even some people will get disorders. This can be due to the variation in the genetic makeup. Okay, few genetic variations can have allergic responsiveness to the few diets. Few variations can have the immunity disorder to the diet, and whereas you can have decreased digestion. For example, few children cannot digest the lactose. Okay? There can be developmental lactose intolerance due to the absence of the lactase enzyme, the breast bladder membrane of the intestinal epithelium. So if we can able to identify that early, that we can advise them to stop the lactose. Otherwise, he'll be okay. At the same time, the few children can have allergy to the like wheat allergy. They can have non-gluten allergy. They can have peanut allergy. So it depends on the genetic makeup. Also, other influence, the environmental, physical, and we have other response as well as the. Let us come to the one enteropathy, common is cilia, where the only people with HLA DQ2 and DQ8, DQ2 and 8 are only affected, others are not affected. Okay, so here the genetic makers definitely has role. So it's the identifying the genetic makeup and in disease and diagnosing the disease also important. So other than physical lifestyle and diet, the genetic makeup is also plays a role in the diagnosis and prevention of the some conditions.
Good. So I remember one of my nieces for a long time kept going to different doctors trying to figure out what was wrong. And given that, she was in Rajasthan, people assumed that, initially that roti cannot cause a problem, right? Like, it was something that we are used to eating. If after seeing many people, they finally figured out it was celiac disease. But today I think that's something that you will think of immediately when that is a problem. But I think years ago, I think people didn't think about doing a test to figure out if there can be possible gluten intolerance and things like that. And I think it's a big thing.
Yes, so even cow milk protein allergy, also milk protein allergy is also prevalent in 1% of the population. Even gluten allergy is also 1% of the population. Generally, this is prevalent conditions.
And I think now that you can find out if there is a susceptibility, some of these conditions we are also seeing are developing after a particular age, right? So maybe when they are at pediatric ages, maybe it might not necessarily show up like a lactose intolerance, but over a period of time, I think we start seeing that also starts to come also. So when people come to you, it is, you're looking at nutrition, you're looking at how food can change potential well-being of a child. Then do you look at like a detailed history of what the family has gone through in terms of like looking at the entire chart, or is it sufficient to just look at the child and be able to make a diagnosis?
It's definitely very important from the infancy to adults and to look at the dietary history. Either we generally ask them we'll recall the 24-hour dietary recall, or ask them to write the average diet on any one day. It definitely gives us a lot of clues. Suppose in infancy, what kind of milk they are, suppose they are using breastfeed, it's okay. If other than breastfeed, what kind of milk they are using, okay, what are its constituency, and how, and other than milk, what they are taking in form of the food. And many now are using as high sugary supplements. So this also helps in identifying the underlying condition. And other than dietary, we can also know the familial conditions regarding the similar condition. Any similar complaints in the family with suffering from similar illness can give us a clue that definitely some issue in the dietary. Okay. So we generally inquire for the entire familial diet history rather than the only children's diet history. Yeah.
One of the things I remember that, we all, when someone asks us about our diet, sometimes we don't tell the truth, right? I mean, because if you ask, what do you eat? I think people don't necessarily write down. But I often tell people that, maybe you won't tell what you've been eating, but your microbiome will show what you've been eating, right? Because it
Yes. Yeah.
is being able to actually show that that is the case. You deal with a lot of young children, and sometimes where even the children can't even talk to you at those ages. But everyone knows that there is a problem, because when it's a gastric problem, I think the babies start to cry or otherwise. But do you think that that has helped in understanding? I remember when I had babies and suddenly they used to cry. It was very hard to figure out what was wrong with them, right? Like, you can't ask them. So how do you deal with those newborn babies, and also their parents, because even many times they are the first time, they don't know what is going on. So I'm sure they call you first immediately when a child cries. So how do you actually understand what is actually going on for those babies?
Yeah, it is when it's come to the newborn children's, they generally develop the intestinal microbiome over the period of time. When it's come to the normal delivery, they develop faster. They have very large diversity in their microbiome, and also breastfeed infants have normal and good diversity of the microbiome. Yeah, because the milk also contains probiotics like lactobacillus reuteri. So in the normally born children with who are on breastfeed have generally will establish a normal intestinal microbiome. When it's come to the other children who are born by the cesarean section, who are not on mother's breastfeed, are going to develop the intestinal microbiome slower than the normal their counterparts, as well as their diversity is low compared to these children. So these children can have the different GI problems like excessive crying, irritability. Okay, and some of the children will respond very well to the some probiotics. Okay, and right now, like lactobacillus reuteri, we generally give to the children who are on other than breast milk. Okay, because breast milk generally contains lactobacillus reuteri, but children who are on formula milk, because formula milk doesn't contain lactobacillus reuteri, so we give supplements to those children with GI issues. Okay. The other way to identify all children is to get these investigations, but however it is evolving, emerging. So we can perform in few children to take the microbiome and see how emerging, how the diversity is, and whether it is really translates into the GI problem or not, or whether it is some other problem. We can advise to the few children and can see. But definitely the establishment of the intestinal microbiome is important, and we can see its effects in the early periods like neonate itself.
So you've been talking about probiotics and also maybe prebiotics in certain cases. So how do you get children to actually take something like how do you get a baby? Are these mostly in because the probiotics that I take, for instance, are in capsule format, right? How does a probiotic, are they mostly going to be in liquid format, like an intro? What is that? I remember there was one. But are they mostly in a liquid format, or is there any other way that
they're available both in like powder sachet like or as well liquid formula? available in both. Most of them are available in sachet format only. So whichever is okay, no problem with that.
So, in the beginning of this talk, you had mentioned about screen time, right? Like there are lots of, lots of children who are spending a lot of time on the screen. Do you think that, there is a way to create a balance? Because clearly a lot of, during COVID, we all got used to even education on the screen, right? Like you also are learning a lot on the screen. How do parents how will they find that right balance, right? Like how do you make sure that you're not completely depriving a child of even having access to some screen time, but how can they strike that balance?
Yeah, the first important thing is the screen time. For children, so various guidelines have recommended the limited screen time, like less than 1 hour when it comes to the children, less than 3 hours when it comes to the adult overall. Okay, so this is awareness of the screen time. First, 1 hour is okay. You can allow till 1 hour. So number one point. Number two point, the parents should also set a role model. They should also decrease the screen time.
Their own screen time.
Yeah, their own screen time. And number three, they have to know, because in the digital era now we have to use this technology and learn them as well, so we can integrate with them some physical activities. Okay, like can use any applications for fitness, walking, your footsteps calculation, so they can enjoy technology there as well as they can do physical activity. And they also should make like physical activities, so should have a day-to-day physical activities plan, like early day in the early morning walk and evening walk. Okay, they should have a routine with them. Okay, and at the same time, when it's come to the weekends, the children should be the parents should be able to take them to the outdoor activities like nearby park, a swimming pool, or any nearby cycling track, which also inculcate increased physical activity. Okay, and we can give them even sometimes indoor games like chess, carom. So this will deviate it from the digital activity screening time. And also, whenever the screen time is increased, there is communication and learning skills is also increased proportionately. So we should follow different methodologies, like to increase activities, outdoor activities, indoor activities, and decrease the screen time, and integrate with the daily physical activities. So these are the methodologies we can follow and reduce the screen time, actually.
So basically doing both the carrot and the stick in some ways.
Yeah. Yes.
All right. So I know we covered a few things. We looked at like certain different aspects of the genetics of GI, whether it is nutrition or looking at things like celiac or different nutritional deficiencies or also microbiome and others. But are there other aspects of genetic testing that you normally come across, or are this? I mean, do you also see a lot of clinical aspects of, you mentioned diagnosing IBS. Do you also use it for, let's say, understanding which medicine will work for someone, or normally the genetic tests are primarily limited to like a microbiome or preventive testing?
Yeah, no, genetic tests are also very helpful in identifying other disorders. Like we have seen predominantly GIT, gastroenterology system, microbiome. But when it comes to genetic tests, also help in identifying the liver disorders as well as the pancreatic disorders. So when it comes to the liver disorders, there can be cholestatic disorder like genetic cholestasis or inborn error of metabolism affecting the liver. Like, okay, where is the simple is galactosemia, fructosemia, tyrosinemia, and glycogen storage diseases. These are the inborn error of metabolism affecting liver disease, as well as the metabolic other genetic disorder like Wilson disease, hemochromatosis, alpha-1 antitrypsin, Alagille syndrome. So there, the genetics tests are also helping identifying the newer diseases in the hepatology, or when it's also in case of the pancreatology. Okay? A few children may have with fatty diarrhea or chronic diarrhea or recurrent diarrheas. They may have exocrine pancreatic insufficiency, whether it can be cystic fibrosis, whether it can be Schwammen-Diamond syndrome, or other disorders of the pancreas as well. So there are, even it's come to chronic pancreatitis or in with the family history and pancreatitis in the early children, it's very important to identify the underlying agent, which gene is responsible. So which helps us in, again, for the prognosis, course of the disease, and what other therapies can be given. So not only the GI problems, but also in case of hepatology and pancreatology and the cholestasis, the genetic tests are very useful.
So many of these, I think, typically are diagnosed during a newborn screening, or do you see more people doing a newborn screen? Do you see also parents who have done a carrier screening before they come, or do you think that it's mostly an afterthought currently, that patients are coming, and that if they did come before, that it would actually help them in mitigating some of these challenges that they're facing?
Yeah, definitely. So as we know that only few of the genetic disorders are well treatable if you identify early, like hypothyroidism. If you identify early, you can prevent any effects. So children can lead a normal life. Galactosemia, you can lead a normal life. Cystic fibrosis, if you can identify early, we can keep the healthy and prolong to prevent the complications as well. So one thing is establishing the screening after birth. Okay, this can prevent a few of the disasters. Nowadays, we are doing for affordable patients. We are doing screening for around 28 disorders in many centers in India. Routinely, thyroid is being done in most of the centers in government and private centers. Now emerging is the carrier screening in the parents and who have the familial diseases within them. Okay, those parents can go carrier screening even prior to conception, and which can help us identifying those disorders early, and whether we can decide and counseling and further as well. So carrier screening is definitely emerging. But we can encourage them in the parents with consanguineous marriages, or in parents with family history of disorders, genetic disorders. We can advise them early carrier screening as well.
So let's move on to something, in terms of, what, questions which I normally like to ask everybody, which is, what is prevention in your, if you had to say what is prevention, what would you say?
Prevention. So when it's come to the prevention is my like division or gastroenterology. So we want to prevent recurrent dietary issues, the digestive issues, or IBDs or metabolic liver disease. So which is there in our lifestyle and our dietary habits, and which can be done by modifying our diet or lifestyle. At the same time, so many things are not in our hands. When some disease happens, or due to the condition, or so we can take the help of the advancing technology like genetic makeup. So we can make up a genetic makeup as well as microbiome testing. So we can take help of these tools as well for the better makeup and better prevention of the diseases as well. As we know, in any population, generally 10 to 20% will be suffering from the chronic ailment. So here the goal is to reduce the severity of it, and make it simple and decrease the trouble of what they suffer. So we can take help of the advancing technologies like identifying your genetic makeup or identifying your microbiome, or you can personalize your dietary, physical, and medicines as well. Yeah. So we can take help of this newer advances as well.
I know you deal with pediatric population, but what is healthy aging in your opinion?
Healthy aging is the so in initial periods of suppose in infants and adolescents, they should be their weight, the physical development should be normal, their mental development should be normal, along with the cognitive skills. Okay. But as children grow, they should be have the good communication skills. Okay, and there should be the children should not affected the peer pressure. Okay, and when it's come to the adolescents, yeah, they should be free from this obesity, especially in the the current era where there is pandemics going on in adults. And that, yeah, that is one thing we can prevent. And as well as there, the very important in this era is that peer pressure as well as the pressures, the competitive world. There is a lot of mental stress. Yeah, there we should be able to mitigate that, or we should be able to neutralize it as well as to ensure a healthy growing children. Okay. When it's come to adult, then you live your life without any chronic ailment or disease. Yeah, that's what it is.
And do you think you mentioned stress and you mentioned a lot of problems for children? Do you think that also reflects somewhere in your microbiome and your?
Yeah, definitely. Stress will alter your microbiome, which in turn shapes, will subsequently alter your immunity and your bowel leaking, and again it goes to your behavior, and it's a vicious cycle. So stress is also one of the very important. So environmental factor. Okay. So we have genetic factor, which is host factor, then dietary, and another is the among the environmental stress is another important factor. So stress alters the microbiome. It is very well known evidence-based phenomena. So it is also important to balancing your stress by following other various non-pharmacological activities.
So, one of the most wanted or discussed this thing is that there are lots of myths around around just being a child, or the kind of things that parents should do for children and others. So what are the most common myths that you come across when you are dealing with parents? What is there that ideally a doctor should clear the air about, that these are not really true?
Yeah, there are few myths in parents, like, yeah, when it's come to infancy, they try to give honey to the neonates, which is again can be hazardous sometimes. No need to give, and many parents wants to give water, again also not needed, because the milk contains about 96% of milk. Milk is water only, so milk satisfies both thirst and hunger. So again, water is also not needed, and other few have some gripe water. Nothing is needed actually. When it's come to the growing children, yeah. Uh, so parents have a few like ceremonial things, but I don't think most of them are not necessary. They can contact physicians nearby. I can take care of the things which are.
So before we move on to the last round of this, which is the rapid fire, is there anything else that you think people should know about that I might have missed out?
Yeah, definitely. When we have the long-term GI issues, consult the specialist in the division, and we have to identify the etiology. So, which also gives us in the understanding the disease and its further course and what therapies are available. So, what we can do. So, when you take care of the early expert advice and identifying early disease, we can save enough time, money as well.
Got it. So let's move to the final part of this round. Are you a morning person or a night person? When are you most
Morning person. Morning person.
What are your hobbies?
Yeah,
Other than
my hobby, yeah, playing games like badminton nowadays. At least you can play. Swimming.
That's great. Do you? What is the most common complaint that your friends have about you?
Communication. I won't answer phone calls immediately. That is one thing most of them complain about. Yeah.
Do you have a favorite book or a movie that you can tell us about?
Yeah, favorite movies. So there are many. A few of them are Inception, like many books. I read many books, so there is nothing like some few favorite. Yeah.
So fiction or more like non-fiction?
Non-fictional. I read. Yeah.
And what is your favorite place to travel to?
Yeah, I would like to travel to North India, basically. So hilly areas, hilly regions like
So are you from the north?
Rishikesh and
Are you from the north or the south?
well, I was born south here in nearby Hyderabad. My great grandparents are from like northern part, middle part of India, like Nagpur.
Yeah, I was going to say Chauhan could be, but it is spelled with an O. So some.
Yeah, my great grandfather are migrated from Nagpur, like so. We now settled here.
So I think we should look at your heritage or your ancestry composition. See if there's some.
Yeah, definitely we can go back and see.
All right, great. Thank you so much, Dr. Pandu. I think it was such a pleasure having you on Genomics Gupshup. We learned a lot today, and I'm sure a lot of not just other people of the medical and the genetic community, but also I think a lot of young parents would be very interested in learning more about all the different aspects that you had mentioned about. So thank you so much. I wish we could have done this in person, but hopefully we'll meet you in person some other time.
Okay.
Thank
So
you.
thank you, ma'am. Thank you for the opportunity.
Thank you.